when it's the birth of your child, you want to feel like you're in control. And I'm so not. That's pretty scary.
The COVID-19 outbreak has obviously been very terrifying, especially for pregnant women.
I would advise for everyone to come up with a plan with their family and their loved ones, come up with a plan together with their OBs.
Traditionally, if you're pregnant in the United States, you visit with a doctor for regular checkups leading up to your due date. When it's time to give birth, you're hospitalized, go into labor, and released a couple of days following your child's birth. Now, COVID-19 is changing some of that.
Hospitals are restricting partners from being a part of the birthing process.
Fears over the coronavirus are leading more pregnant women to consider delivering their babies at home.
So the couple purchased this medical supply kit online, preparing for a possible home birth.
Everything's just super uncertain right now.
We talked to pregnant women about how they're feeling and how the coronavirus pandemic is making them rethink their birth plans.
My name is Carly Wagner. I am 22 years old. I'm expecting my first child. I was already a high-risk pregnancy. It's very likely that I'll have to get a C-section or that I will go into preterm labor, which means I will give birth early. Every day the news just kind of seemed more bleak. I went from feeling so prepared, and then as soon as this hit, money has to come from somewhere. My partner got laid off temporarily because of the virus. I want to be proactive and, prepare for things, but you don't know what to prepare for.
Pregnancy is already a stressful and challenging time. There are major life changes, body changes, emotional changes, and pregnancy during a pandemic brings all kinds of new challenges and stressful situations too.
This is Dr. Lena Wen. She's a physician, the former health commissioner of Baltimore, and a former president of Planned Parenthood. For her, this is also personal.
I am 38 weeks pregnant myself at the moment. Pregnant people are still medically vulnerable because of changes to their immune system, to their physiology, and should take extra precautions the way that other categories of people who are medically vulnerable should take precautions as well. We believe, based on the limited data we have, that there is no maternal fetal transmission because there isn't COVID-19 found in amniotic fluid. It's not found in breast milk. But these are preliminary studies, and there is a lot that we just don't know about the impact of COVID-19 on pregnancy.
Being pregnant is terrifying enough because of all of the things that could go wrong.
Because of Anita's age, she's even more at risk.
I'm in my mid to late 40s. I was going to have a baby shower that I was excited about because this is a first pregnancy, and I may not be able to have that. That's kind of heartbreaking.
Anita lives in New York, the epicenter of the virus in the United States right now.
There's always the fear of infection and contamination. You're still dealing with medical staff. You wonder how much cross-pollination there is.
Unfortunately, when we look at what has happened in other countries, there are certainly documented cases of people having delayed care during pregnancy or even foregoing certain types of care during pregnancy because their providers have simply not been available due to this overwhelming capacity demands on our healthcare system.
I actually was going to look into a doula around now. And of course, with these new recommendations, I'm not sure it's the right thing to do.
Now is the time to prepare. This is not a time to panic. There are steps that we can take to prepare ourselves and our families.